Hi, I'm Nicole Keith, and I'm an associate professor in the School of Physical Education and Tourism Management. A promise that IUPUI made to the community members is that we would always serve the community. And hospitals are prominent. When people get sick, they know where to go. The campus is part of the community. And what we want to do is to do our part in wellness by keeping people healthy. The PARCS program, it's a service learning program, and so what that means is that the activities that the students do in the community are tied specifically to course objectives. And if we didn't have this program, what we would be doing is pretty much asking students to imagine if you were out in the community and try to tie that to book knowledge. And it's really difficult to make up people, to make up chronic conditions, to say, pretend that Mr. Smith has high blood pressure and has just been released from cardiac rehab. It's much more meaningful if they can go out into the community and meet Mr. Smith. With the gift from Anthem Blue Cross and Blue Shield Foundation, we're able to now assess the impact. And we're measuring student learning, but we're also measuring community health by doing fitness tests with the participants and really talking with them about what the program means.
Hi, I'm Adam Still. I'm a 2006 graduate from IUPUI. I was in the PARCS program in 2005-2006, and I'm the sports performance and fitness coordinator at George Washington High School. I feel like being able to take what I learned from the classroom and apply it to a community standpoint is very, very important to your education. There's a lot of things that you learn that you don't necessarily know how to tweak them until you get out in the field, because everybody's different. Every person has a different way of learning or necessarily of working out, and just being able to use that is very important. The adults and the kids are taking a little bit better care of themselves from a physical standpoint, just from looking at them. Their chest sticks up a little bit more. Usually kids come in here and adults come in here with their heads down, bad posture. Now you see them chest up, shoulders back. So I've noticed just from looking at them, and not even necessarily talking to them, but just from looking at them, from my office, you can really see the difference in the community members and the students that come in here. When we first started, we had concrete floors, 2 bench presses, dumbbells that only went up to maybe 50 pounds, hardly anything. And it went from that to, you look at the weight room right now, if you can't get healthy in here, you can't get healthy anywhere. And in this situation, it's because you're doing a lot of one-on-one work, and you're not sitting behind a computer typing out something and sending it to somebody. You're actually working with them and being able to utilize your people skills, and knowing it is one way, but being able to tell the other person that don't know anything about weightlifting or exercise is a totally different. It's lost in translation. So being able to take what what you've learned through the textbooks, and then being able to change around and apply it to somebody that has no idea what's going on, that's really helped out a lot.